Welcome to Nashima News. I am Rizwan Asad. There is a saying, health is wealth. And with today's sedentary lifestyles and with junk food around the corner, a lot of people are obese. We have seen not only the old people, even youngsters from the age of 10 to 12 years are being obese. And this is a major problem. And there are a lot of medicines in the market, weight reduction medicines, oils, etc., etc., etc. Today, I am with one of the leading bariatric and laparoscopic surgeon, Dr. Gmoinoddin. Welcome, doctor.
Hi.
Dr. Gmoinoddin, a young doctor who has performed surgeries, bariatric surgeries to various people, and he has brought them back to life. Today, he is going to explain what are the benefits of the bariatric surgery as well as laparoscopic surgery, and what are the benefits as well as what are the side effects. Doctor, you have had major surgeries you have done. You are one of the best laparoscopic surgery and one of the bariatric surgeries. What are the benefits of bariatric surgery and why is it necessary? Because we have seen so many medicines, we have seen so many oils coming in the market and so many weight reduction tablets. Ultimately, I can't say whether they work or not there. You're the best person to say why is bariatric surgery necessary today?
Yes. First of all, Assalamu alaikum. Thanks to Nashima News for giving this opportunity. So, Bismillahirrahmanirrahim. So, we all know that there is a bigger pandemic than COVID that is called obesity. Obesity is a bigger pandemic because people doesn't know this. Even if in the lockdown you can see a lot of people started eating junk food, bad lifestyles, staying at one place, watching too much of screen time, no walk, and a lot of calories consumption has made everyone obese. Now I can see the number of surgeries has increased. When I took this branch 10 years back, when I thought that obesity surgery is going to be a booming branch in future because everyone is obese in their own way. You see some people are 5 kgs obese, 10 kgs overweight, and some people are 50 kgs, some people are 100 kgs. So what happens, this obesity is, and definitely this obesity is the mother of all diseases. This obesity causes all the diseases. It's a root for all the diseases. You see if they're obese, they get diabetes, type 2 diabetes, they get hypertension, they get hypercholesteremia, they get sleep apnea, that is snoring in the night.
And then you have knee problem.
Knee pain. They can't walk because of the knee pain. They consume a lot of medication for knee pain and back pain. And even in young females, we see polycystic ovarian diseases where people don't menstruate for 6 months and 1 year. And even it causes.
So this is one of the causes where that girls don't conceive because of the ovary.
Yes. So many of the times, what happens? There is a cyst in the ovary. What happens during menses? They don't get menses at all for 6 months, 1 year, 2 years, and all these things. And in some patients, even though they conceive, they don't retain the baby because of it's not a healthy egg. So even this leads to infertility also.
What about in men, sir? Because even men, when they're obese, their lifestyle will change, and even they, malfunction or something.
I'll just show some picture of here.
Okay, yeah. Before. You can just. Your doctor is going to show us what is exactly bariatric surgeries and what are the benefits and
This is.
Yeah. So this is the chart.
Before.
And exactly he's going to just show us what's exactly going to happen. Yeah.
So if you see from top to bottom, you see a lot of diseases. You can see severe sleep apnea, that is snoring in the night, and the oxidation saturation drops in the night. Even fatty liver, because liver is the first organ where fat deposits. This patients even have carbohydrate disease, abnormal menses, PCOD. You can see patients will get cancers, that is colon cancer, breast cancers.
So you mean to say the person who is overweight has got cancer?
Yes.
What are
No. The chances of getting cancer is more compared to the thin population.
So
This is the thing. And you see diabetes, you see blood pressure, you will see lipid profile abnormalities. You can see strokes in this patient because what happens when you're obese, even the fat accumulates in the heart vessels. That will cause strokes and all, cardiac stroke and cerebral stroke.
So what is this when it stretches the pelvic beats and goes?
So basically,
what is this? Because varicose veins also.
Knee pain will happen, and even the veins, which are the legs, that is called dilated veins. Varicose veins also happen. Some ulcers also will happen because veins, this blood stays there for long time.
So what exactly should be the BMI of a patient? Because everybody according to somebody's body,
yes,
they have a different weight, different thing.
Yes.
So what exactly like say a person who's 5'10" or 5'11", his ideal weight and what is the BMI?
See, basically everyone should know that Height in centimeters minus 100 is approximate weight. If a person's height is 170 centimeter, minus 100, 70 it should be. If the person is 100, it's 30 kgs over. It's very simple. No need to have a calculator also. But we calculate in the form of BMI, that is body mass index, weight in kgs per height in meter square. If you calculate, you'll get this value, that is called BMI. The normal BMI should be less than 25. 25 to 30. 25 to 30 is overweight. More than 30 is obesity. 35 to 40 is class 2 obesity. More than 40 is morbid obesity. What happens when a person is like this, overweight or class 1 obesity? We give a trial of diet, lifestyle modification, physical exercise, and some small changes in the lifestyle. If the patient loses, it's well and good. If they don't lose, if they are too much morbid obese, and if they have diabetes, blood pressure, we can do this surgery. So,
what is the age for a person to undergo this operation?
see, usually there is guidelines for American Society of Minimal Access Surgery. So the guidelines say 16 to 65 years. But what happens is nowadays I can see childhood obesity. Just now I saw a patient with childhood obesity. And what we do is basically surgery before, any surgery was done open surgery before. You can see this, the world has started with an open surgery. Now, any surgery, even in the gallbladder surgery, even in the hernia surgery, uterus removal, colon cancers, anything, abdominal surgeries, we can do with a small keyhole.
Keyhole surgery.
Keyhole surgery. It's become a keyhole surgery.
Laparoscopic.
You don't have laparoscopic surgery, we call that. You don't have much scars here. There is no concept of stitch removal and all. So we do the surgery, and the next day the patient is getting discharged many of the times.
Now the laparoscopy has come. What is the, people have got this wrong conception saying that, this is very costly, and then you have side effects. When people, will they get back their weight once?
No, not like that. See what happens, everyone should know that all the surgeries nowadays it is done by laparoscopic, small keyhole. So what happens in this way, when you do a laparoscopic surgery, the duration of the surgery is very less. The anesthesia time is very less. And the patient, we make them walk within 3 hours after surgery. We don't even make him walk next day. It's 3 hours after surgery. And the next day, most of the patients goes home. So what happens in that way, hospitalization cost is reduced and early mobilization, and the patient can resume the work within 2-3 days.
What are the side effects, doctor? Because once he loses weight, his body, which was God given gift, your doctor has altered it. So will he be losing his hair? Will he, become weak? And will he have the same lifestyle?
Yeah, I'll tell you one. So what happens when you do the surgery? Post-surgery follow-up is very important. Every 3 months, the patient should be in constant touch with us. So in that way, what happens? Any small changes, any small things, we can make it happen. And we want them to take protein powders and multivitamins and all. If they are in follow-up, I think the complications are very, very less. I think this is a problem with many of the patients. What happens? When they do surgery, they lose a lot of weight, and they'll be like overconfident that they can do without a doctor. So that's not a good concept. They should visit us frequently so that what are the chances of hair fall and loose skin minimize? We can minimize it.
There is acidity problem. You will have this bowel syndrome. So how do you control that? Because see, most of the patients who have undergone this surgery, they have constipation. So how do you think, and how many surgeries are there? We have got a sleeve surgery, we have got a gastric bypass, and what is others?
So basically, the major 2 surgeries are gastric sleeve and gastric bypass. So I'll explain how we do the surgery.
How many types of surgery? How many types of surgeries are there?
Yeah. So bariatric surgery broadly has 38, 39 type of surgeries in the world. Some surgeries are more common than Japan, some are very common to the Korea, some people in China and all. But worldwide, if you really see, broadly we divide the surgery into 2 types. One is gastric sleeve, one is gastric bypass. In the gastric bypass, there is mini gastric bypass, bone marrow gastric bypass. What exactly do in gastric sleeve is, we reduce the size of the stomach. So what happens? This part we will staple and remove it off. So the new stomach is only 15 to 20%. So the patient can eat less. The patient can eat only 20% of what he is eating. How the surgery works is, one is the quantity is reduced. Number 2, this part of the stomach has hunger hormone, the desire to eat. It will be removed so that the hunger will be reduced. And number 3, hormonal changes happen. In gastric bypass, what happens is, we don't cut and remove anything. This stomach, this small intestine, this stomach we reduce it to 20% and join with the intestine. Before, food used to go like this, go like this, go like this in a way. Now food will take a bypass route. That's the result is called gastric bypass. In this mini gastric and Rowan, the difference is the pouch is smaller here, the pouch is bigger here. And the most commonly done surgery is mini gastric bypass.
Now, doctor, why should people exactly come to you and do surgery?
Yeah.
You said there are various causes like diabetes, hypertension, knee problem, joint problem, hip problem. So, people today with their lifestyle, with eating junk food,
Yes.
this is necessary.
Yeah, I'll tell you one thing. For example, if as I said, you height in centimeters minus 100. For example, his weight should be 70. If he is 130 kgs, he is 60 kgs overweight. If you are 60 kgs overweight, you are obviously going to develop type 2 diabetes. You are going to develop high blood pressure, cholesterols. And if the person, for example, he is 130 kgs, he go to the endocrinologist and physician. They start him on insulin, tablets and all. So what happens? Those doctors also will suggest lose weight, because not only the medication will control, even the weight loss will help you in losing, controlling the diabetes and all. So what happens? They try with medication and all. If those medications don't work, for example, the sugar is not getting controlled with even 50 unit insulin, 100 unit insulin, then what is the option? They keep on increasing. There is no limit for it. 100 becomes 150, 150 becomes 200 insulin and all these things. So those patients we operate and the sugars comes down. The sugar levels comes down. With the surgery, what happens? The surgery starts acting from day one. So over a period of from 1 week to 10 days, many of the times we stop the medicine for diabetes because this diabetes is got because of obesity. And even many of the times we get patients with 5 antihypertensives, 4 antihypertensives. Slowly we gradually reduce it.
How many surgeries have you done till now, doctor?
I have been in this field from last 12 years. I was in Belgium, Taiwan, Korea, Bombay, Delhi, Gujarat and all. But after coming to Bombay, after coming to Bangalore, I have done around approximately 350 surgeries.
And your clients are from Pan India?
Yes.
Gotcha.
Pan world, I can say, international.
Doctor, we have seen a lot of trophies you have got being a thing.
Yeah.
So, how do you see a patient once he loses his weight? What is the happiness you get because you're giving back him life?
Yes.
And he's come back. He's lost his weight. He's come back.
Yes.
So, do you think that he should continue consulting you?
Yes. See what happens when the patient comes usually.
Yeah.
So when the patient comes usually, they are suffering with severe knee pain. They can't even walk to the washroom. Those patients, they lose weight and they'll be happy they can walk to the washroom. Basically, we are including the quality of life, and we are stopping the medicines for diabetes, blood pressure, cholesterol, the snoring, the sleep machines also will be removed. So in this way, the quality of life is improved.
So his any tablets he has to have lifelong, like calcium or vitamin or
Basically, what happens, this pandemic, everyone is taking some tablets. So what I feel is they should take medicine for diabetes and they should take multivitamins and proteins for 2 years. Afterwards, whenever it's required, it's required. It's not complete like
so we have guarantee sugar won't come, guarantee the hypertension not come, because I've spoken to a lot of patients and everybody has given a very good review of you.
Yes.
Now, doctor, one last question. Today we are seeing all 10-year, 15-year, 20-year-old children and young adults are obese.
Yes.
When do you recommend a surgery? Because see, you are very well versed in this field. Because at a certain age you can't lose weight. That chalo. What about a youngster, a 15-year or 20-year-old boy? He wants to undergo surgery. How will you convince him to lose weight, or you want to perform a surgery?
I'll tell you what. Whenever a person comes, we should always try with ABCD. That is diet modification. We have to make small changes. There should be no sweets, no sugars, no bakery items in the life. And number 2 is the rice should be in less quantity. We will try with the diet modifications, avoid this all high calorie food, high carbs. Okay, when we do the lifestyle modification, we ask them to walk for 45 minutes to 1 hour per day. We will give a trial for some time. If the patient still doesn't lose weight and if he is having a lot of other health issues, then we will suggest the surgery. And the surgery, the BMI should be more than 32.5. There should be a clear indication. Less than 32.5, we don't.
So you do blood test, everything you have. What is the procedure for this?
Before surgery, what happens? It's quite simple. The patient has to get admitted 1 day before, 1 day prior. We'll do all the blood tests. We see his hemoglobin, his kidney functions, renal functions, ultrasound, how is his fatty liver, how is his heart, everything. Then next day, what we do the surgery. Within 3 hours after surgery, we'll make him walk. The next day after surgery, we'll discharge him.
It was very nice speaking to Dr. Gmoinoddin, one of the leading bariatric surgeons. He has done more than 350 operations. He has brought back life, cheer and good life to these patients who were suffering from obese. And with this bariatric surgery, many have regained their lifestyle and many have Stop taking diabetes tablets, hypertension tablets. If you want a good healthy lifestyle, if you are craving for good food and junk food, please stop it. And if you can't stop it, you're overweight, there's always Dr. Gmoinoddin at your disposal to bring you back in shape. Rizwana sir, signing off for Nashim.
And small Salva. So basically, life is a luggage. Okay, life is a journey. When the journey is there, the lesser the luggage, the longer the journey. So what happens if the person is carrying 2 bags? How much distance he can walk? If he is carrying only 1 bag, he will walk little longer. If there is no bag, he will walk little more longer. So basically, we are shedding the luggage. So his longitude of the life is increased.
So doctor was very clear. The less the luggage, the more your life, healthy life. Be happy, be healthy. Keep watching Nashim News with me, Rizwana sir.